Hi, this is Bob Vineyard with the Georgia Medicare Medic. Let's talk for a moment about something that you probably don't hear thrown around very much, at least not in the Medicare market, and that is risk management. I have been in the health insurance business for over 40 years. I've worked with individuals, I've worked with small companies, with large companies setting up their group insurance plans, and it's always about risk management. The only reason that you buy insurance is to limit your exposure, limit your out-of-pocket exposure. When you buy health insurance, it doesn't mean that you're never going to get sick or never going to have an accident. But when you do have an accident, when you do get sick, there's health insurance there to cover the out-of-pocket expenses that you can't afford to. The $5,000, the $10,000, the $20,000, the $100,000 claims that for most people, that's going to set them back pretty hard if they even have the money to pay those. But as I said, health insurance does not, which would include Medicare supplement, Medicare and Medicare supplement. Health insurance does not mean that you're not going to get sick, you're not going to have large medical bills. Any more than buying life insurance doesn't mean that you're not going to die. When you buy the life insurance, when you do die, if the insurance is still in force, then money is paid to your beneficiary. As I said, it didn't prevent you from dying. But with the health insurance, and particularly with Medicare supplement, what we're doing is we're talking about how you can limit your out-of-pocket on large claims to, in most cases, less than $200 a year. And that's pretty significant because many people, especially those who are coming off plans, either individual or group insurance plans, many people are accustomed to $1,000, $1,500, $2,500 deductible or higher, and then they have co-insurance on top of that, which means that all of a sudden they could be looking at $2,500, $3,500, $5,000 out of pocket in a bad year. We're talking about, as I said, in most cases, limiting your out-of-pocket expenses for inpatient and outpatient to less than $200 a year. Now, this is in 2018. There are some deductibles in there that are set by Medicare, set by Congress, some Medicare deductibles that are set by Congress, and those do change. And over time, if you're looking at this 5 years in the future, you may get a laugh out of me saying that we limit your exposure to less than $200. But the point is, we're talking about risk management, keeping your out-of-pocket expenses affordable for most people, and at the same time also showing you plans that have premiums that are affordable for most people. Most of my clients actually have premiums that are around $100 to $110, maybe $120 a month. $120 a month is $4 a day. It's less than a Starbucks coffee. Now, I'm not making light of that because I know some people have tighter budgets than others, but I'm just saying that $4 a day is a pretty small price to pay to limit your out-of-pocket expenses for health care treatment to less than $200 a year. That's my approach to it. You may have a different opinion, and that's fine. But if you want information about Medicare options, specifically Medicare supplement plans, I'll be glad to talk to you about it. Just give me a call. I always say, give me 5 minutes, and if you don't like what I say, then you can hang up. You can actually hang up in the first 30 seconds if you want to. I won't like it, but I'll get over it. But give me a call. We'll talk about it if you like what you hear and the kind of information I can provide you. Then let's talk about doing business. If you don't, you go your way, and you have fun with that. So this is Bob Vineyard with the Georgia Medicare Minute. You have a nice day.